Good day, everyone, and welcome to another episode of the Circle Direct podcast. I'm your host, Dr. Tiwa, and today we're going to delve into a really important topic. We're talking today about acute kidney disease. We're going to buttress some points about the symptoms, the investigations to do, what to look out for, the causes, the people that are susceptible to getting acute kidney injury. So, as an healthcare professional or someone that is probably dealing with some of these symptoms, this episode will provide a bedrock of information for you to understand and learn of how to manage and take control of this particular ailment. We hope for you to stay informed and let's. So, what is acute kidney disease? Sometimes it's referred to as acute kidney injury. So, this is an abrupt or a sudden decrease in kidney function, which encompasses both structural injury or impairment of the kidney function. This condition occurs when the kidney suddenly loses its ability to filter unwanted products. As you know, the function of the kidney encompasses making sure that the blood pressure of the body is well maintained, the electrolytes in the body are also well maintained, and also helps with the fluid balance in the body, as well as, most importantly, filtering unwanted products. If it is unable to filter unwanted products suddenly, that is where we get acute kidney disease or acute kidney injury. And when these kidneys fail, the dangerous levels of waste can accumulate suddenly in the body, causing a very grave condition. This is what we are going to seek to make sure that doesn't happen for you or for anyone that you notice has these symptoms around you. So, what are the causes of acute kidney disease? So, the causes of acute kidney disease are usually classified into three. The first one is prerenal, the second one is renal, and the third one is postrenal. For the prerenal causes, it's in the name. Prerenal would mean the affection of kidneys due to the flow towards the kidneys. So what is impairing the blood flow to the kidneys so that the kidneys are unable to do their work? For instance, hypotension. If the flow of blood is not adequate to the kidneys are under undue stress. Heart failure, to use an example, or severe blood loss. All these things will slow down the movement of blood to the kidneys, so the kidneys are unable to do their work as required. Then, secondly, we have intrarenal causes. This is when the kidneys themselves are affected directly, either through inflammations of the cells, for instance, glomerulonephritis. The glomerula is the filtration chamber of the kidney. So if there's inflammation of that glomeruli, that is what we call a direct affection of the kidneys itself. There's also tubular necrosis, acute tubular necrosis. That is also an example of a direct affection on the kidneys. Then we have postrenal causes. So we've talked about the blood flow to the kidneys itself. We've talked about the kidneys themselves being affected. Now, for the postrenal causes, it is when the outflow of when the kidneys have done their work is also affected. This can be caused by, for example, an obstruction to the urinary tract. If there's a small stone in the urinary tract, tumors, or, for example, an enlarged prostate, it can lead to this is what we call a postrenal cause. Because when, for instance, if a stone is in the tract, it obstructs flow of urine out of the body. Excretion is impaired, leading to stasis. And if there is stasis, which is when the fluid that is passing through the tract can't pass all the way, that is a place where infections can happen, swelling can also happen. So these are the three types of affections of AKD, acute kidney disease. Prerenal acute kidney disease, which is caused by inadequate blood flows to the kidneys. For example, severe dehydration, heart failure, low blood pressure. Then we have intrarenal acute kidney disease, where there's a direct damage to the kidney tissues themselves. Examples: acute tubular necrosis from toxins or ischemia, glomerulonephritis, which is the inflammation of the filtering units themselves. Then we now have postrenal acute kidney disease, which is blockage or obstruction of the urinary tract, preventing the outflow of urine from draining out of the body. For example, we have things like kidney stones, ureteric stones, enlarged prostate, like in benign prostatic hyperplasia, or tumors in the urinary tract. So these are the causes of acute kidney disease. When we're talking about the stages of acute kidney disease, we're talking about 3 stages. The first one, we're talking about the mild acute kidney disease, where we see that there's a slight increase in creatinine levels, 1.5 to 1.9 times the baseline, while the urine output is 0.5 mils per kg per hour for 6 to 12 hours. This is a bit technical in the sense, but the normal amount of urine that we produce per day that is adequate is 1.8 to 2 liters per day. So if we have less than that, let's say we have from 1.2 to 1.5 liters of urine passing, that's when we might notice that, okay, maybe this is a mild acute kidney disease. Then we go to stage 2, which is moderate. Here we notice that the creatinine levels are increased 2 to 3 times the baseline, while the urine output is also less than 0.5 mils per kg per hour, but over 12 hours. Then we go to severe, where the creatinine levels increase more than 3 times baseline. This is actually very close to what it is for the chronic kidney disease, and the urine output is less than 0.3 mils per kg per hour for more than 24 hours, or anuria for at least 12 hours. Anuria being the patient is unable to produce urine for a period of 12 hours. For this condition, it may require dialysis. This classification will help guide the treatment module that would be required for each of these stages. In terms of the risk factors of people that might be likely to get AKD, which is acute kidney disease, if you're age 65 or over, if you already have a kidney problem, such as chronic kidney disease, for instance, if you have been managing chronic kidney disease, you can get an acute kidney disease suddenly. Then, if you have a long-term disease such as heart failure or liver failure, or even diabetes that is not properly controlled, an acute kidney injury is very possible. If you are dehydrated or unable to maintain your fluid intake independently, that is also a risk factor for acute kidney injury. And if you have a blockage in your urinary tract, kidney stones, ureteric stones, for instance, you are at risk of acute kidney injury. Also, if you are taking some certain medications, for example, pain medications, if certain class is more susceptible, that's non-steroidal anti-inflammatory drugs, they can also affect your kidney function. Also, if you're taking diuretics, that's ACE inhibitors, they might help you in terms of outflow of urine from your body, but it wouldn't help if you are severely dehydrated or suffering from a severe illness. Some antibiotics are also known to only be given in the hospital because they are likely to increase the risk of acute kidney injury. So what are the symptoms that you have to look out for if you have, or if you notice that there's someone around you that has acute kidney disease or acute kidney injury? You have to look out for a couple of things. First of all, you can go from head to toe. Does the person have confusion or mental sluggishness? Are they unable to answer questions as efficiently as possible? Secondly, do they have shortness of breath? Thirdly, do they always feel nausea? Do they have this nausea or vomiting? Do they feel fatigue or weak? Do they have chest pain or pressure? Do they have swelling in their legs and their ankles? So you can go from head to toe just to ask someone around you, do you have these symptoms? And do you have these things from time to time? Some of these symptoms actually overlap with other conditions. So you have to be very particular about diagnosing acute kidney disease, because not only do you need to know the symptoms, they still need to go to a hospital to do tests. And when it comes to assessing your kidneys, there are three ways. First, you check the blood to see if the waste products are eliminated properly. Then you can do a scan to see the kidneys structurally. And lastly, you can do a urine test to make sure that the waste that is being eliminated is eliminated efficiently and there are no useful materials that are also getting out of the body through the urine. The blood level for acute kidney injury will always show increased levels of creatinine and urea, and these are harmful substances in excess in our blood. So if you see that, they are actually a candidate for this condition. In terms of treatment of acute kidney disease, we have to follow some modules. First off, you have to address the underlying cause. So for some people, they may have heart failure, or they might be nursing diabetes, or maybe they're treating a severe sepsis or infection, or even they might be managing dehydration or removing an obstruction. If you are able to look at these causes, for instance, we've already spoken about the prerenal cause and the postrenal cause, as well as the intrarenal cause. So if you have a prerenal cause, for instance, which is low BP, for instance, treating or addressing the low BP would be the main thing to ease the pressure on your kidneys. Now, if you have an obstruction in your urethra or in your kidneys, removing that obstruction will adequately help out to reduce the stress on your kidneys. So addressing the underlying issue is number one in the treatment of acute kidney disease. Secondly, some medications help to balance your electrolytes and treat any complications such as fluid overload or hypotassium levels. So medications too can help. Thirdly, in severe cases where the kidneys can no longer filter unwanted waste, we come to the point where dialysis is the only module that will work effectively for this patient. And lastly, lifestyle adjustments are always the best in terms of making sure you are managing this condition effectively. Especially if you are diagnosed with acute kidney disease, you may need to change your diet, reduce the salt in your diet, and also your fluid intake would have to be managed judiciously so as not to overload your kidneys in terms of what they need to excrete out of your body. For acute kidney disease, treatment can lead to full recovery for the patient. But in terms of the ones that can lead to chronic kidney disease, if left untreated, they would lead to chronic kidney disease or even long-term kidney failure, especially if your kidney functions are unable to return to normal. Lastly, we'll talk about prevention of acute kidney disease. While some cases of acute kidney disease are unavoidable, there are always ways to reduce the risk. And these are some prevention tips that would be adequate for you to understand and to learn. First, stay hydrated. This is very simple. Drink as much water as you can. Dehydration is one of the leading causes of prerenal acute kidney disease, especially in older adults. So ensure you drink enough water and keep yourself hydrated at all times. To know whether you are dehydrated, you can check your tongue, you can pull your skin to see if it is drier, or you see if your tongue is also dry. If you feel like your tongue is dry, drink a bottle of water. It's always advised to drink at least 2 liters of water every day. Monitor your medications. If you know that you have medications that might affect your kidneys, make sure to have this discussion with your healthcare provider so that your dosages are regulated adequately to prevent you leading to acute kidney disease, for instance. If you have any chronic condition, manage your chronic conditions effectively. This is especially important for people that have hypertension or blood pressure issues as well as diabetes. Make sure that these conditions are managed properly because your kidneys are usually the ones that are affected if they are not managed properly. For instance, we already talked about low blood pressure affecting your kidneys prerenally. High blood pressure too can affect your kidneys. And also diabetes can also affect your kidneys. So managing your chronic condition will be best to make sure that your kidney health is fair. and then regular health checkups. I've already spoken about the 3 ways to check your kidneys. Make sure you do these things as often as possible, especially if you're someone that is managing a chronic condition. Doing a general body checkup is adequate for you to understand where you are. Knowing your EGFR at all times is also paramount. So if your EGFR is optimal, that is more than 90, EGFR being your glomerular filtration rate, if it is more than 90, you know that, okay, you are in the best position to be away from acute kidney disease. So regular health checkups will help you in managing this condition effectively. Recovering from AKD is challenging, but it is something that can be done, especially if you follow the instructions that have been given in this episode. And making sure you have a support system around you and being transparent with them, either with your struggles or even with your processes of managing it, would also help you in the long run to recover physically as well as emotionally. And for people that have AKD that progresses to chronic kidney disease, you would need long-term adjustments, especially with your visits for dialysis, or maybe with the medications that you need to be using, or even with your diet. Always be transparent with your healthcare provider as well as your family so that they are also in tune with your treatment. For instance, if you cannot put salt in your meals, don't let the person cooking for you, or even if you are cooking by yourself, put salt in your meals or reduce the level of salt in your meals so that everyone in the family is also in tune with you in terms of how you are eating. Togetherness will help you recover emotionally, physically, and mentally, because the ailment is not only for you to manage, it's for your whole family to manage and progressively manage with you. So we've come to the end of another episode of Seco Direct. Acute kidney disease is a serious condition, but it's not a condition that you cannot recover from. Awareness, early detection, and the right treatment will put you in the right stead to a recovery that will be adequate for you. People have recovered fully from acute kidney disease, so it's very important to stay informed about your health and be proactive in terms of everything that regards your body. Thank you for tuning into this episode of Seco Direct. I remain your host, Dr. Tiwa. And if you have any suggestions or any questions that you want to ask from us, please leave them in the comment section below. I will be glad to answer each and every one of them. Thank you very much, and I'll see you another time.